Hey guys, my name is Renji.
And I'm Jessica Wicks.
We're both part of the Loma Linda Emergency Medicine Residency Program. We're here today to talk to you about altered mental status. That is actually one of the most difficult chief complaints you'll encounter in the ER, mainly because the differentials can be so broad. There are many different ways of approaching altered mental status. We're here to talk to you about our method.
So when I first learned about altered mental status, I was taught the mnemonic AEIOU tips.
Me too.
I can honestly never remember the difference between the first I and the second I, and what does the P actually stand for. So what we're going to do is we're going to get rid of it today. We're going to think about it in a completely different way. So when you get an undifferentiated trauma patient in front of you, ATLS tells you to go head to toe, essentially, in the format of A, B, C, D, E. When you do a procedure, we think of it from step A all the way through to step Z until we're done. So what we're going to do is we're going to break it down and we're going to go head to toe and see what we come up with.
All right, so here's our undifferentiated altered patient. Let's go ahead and take away everything else and think about it from a head to toe manner. So first, you have the brain. Here, we're thinking about infections like meningitis or abscesses, masses that are causing mass effects, seizures and postictal states, psychosis. You may want to consider ordering a head CT, and you may even need an LP.
Next, in the thyroid, you want to think about gross hypo and hyperthyroidism, and then consider adding on a TSH and a T4, particularly if you see a goiter.
In the lungs, we're thinking about pneumonia, hypercapnia, hypoxia. So go ahead and treat the hypoxia, get a chest x-ray, especially if you can't get a good history or have good exam findings.
Next, for the heart, particularly in the elderly more so than the young, an MI can cause altered mental status. Additionally, tachycardias and bradycardias can give you altered mental status as well. So what you want to do is consider adding on an EKG and also cardiac enzymes, and maybe if you're proficient enough, getting a bedside echo.
A little lower down, we have the stomach, and in the stomach, we're mainly thinking about ingestion. So whether that be toxins or medications we give the patient, here it is very important to get a good history. So talking to EMS providers, bystanders, family is very, very important. So get a UDS, acetaminophen, salicylate level, blood alcohol levels, and then give naloxone if you're suspicious enough.
In terms of the liver, what you want to think about is things like hepatic encephalopathy. Consider adding on an ammonia level.
In the pancreas, we're thinking about sugar, so either hypo or hyperglycemia. So check a blood glucose and treat it.
In terms of the kidneys, you want to think about electrolyte abnormalities, including uremia, hypernatremia, also hypercalcemia. Additionally, the adrenal glands are right there, so you want to think about adrenal crisis and maybe giving the patient hydrocortisone.
And then we have the bladder. Here we are thinking about UTIs, so checking a urinalysis, getting culture is important.
Last but not least, the skin exam. So what you want to do is at least roll the patient, take a look at their back, other extremities, and check in for things like cellulitis, necrotizing fasciitis. Also looking in their groin for Fournier's gangrene. Additionally, you want to get a temperature and checking for hypothermia, and then treating those as well.
All right, that's our head to toe approach for altered mental status. Hopefully that was helpful. And then remember, forget about AEIOU tips.